Hello, everyone. My name is Joe Tibbs. I'm the president of HAPevolve, and today's HAPevolve Solutions Spotlight. I'm incredibly grateful to have Shanna Palmieri, who is the CCO and co-founder of TransferAll, one of HAPevolve's newest industry partners. Shanna, thank you so much for taking some time with us today.
Thank you, Joe. It's a pleasure to be here today.
Shanna, before we kind of jump in, talk to us a little bit about TransferAll. Tell us how TransferAll came to be.
Absolutely. So TransferAll came to be when I was working as a clinical social worker at an academic hospital in the District of Columbia. Our CEO, Nathan Reed, was also working at that hospital. He was the CIO, and he has a background in information technology and healthcare software. During the time at that hospital, I experienced the impact day to day of patients boarding in the emergency department and the impact that had on the patient's quality of care, the efficiency for the staff, the cost that it had on the healthcare system. And we came together and identified TransferAll as a solution to expedite patients' access to care and to improve ED throughput and patient quality of care.
Can you talk to us the behavioral health aspect of emergency rooms, and what's the kind of the standard, maybe what are some of the challenges facing hospitals today?
Absolutely. Thank you, Joe. I think when we're looking at the system today, with behavioral health patients that may come into the emergency department, the clinician has to be aware of what all of the resources are along the entire continuum of care. And part of what TransferAll is doing is creating a system for a clinician where they don't have to know what all of those resources are. All they have to know is their patient and what that patient needs. And the platform will identify in order of distance away the options for the patient and beacon the request out to find that placement as quickly as possible. This process frees up resources for those clinicians in the emergency department to take care of patients rather than do manual administrative tasks on the phone, making phone calls, trying to find appropriate placement.
Can you walk us through some of the complexities from a clinical perspective that makes this such a unique challenge to try to solve for?
Absolutely. Joe, the challenges of behavioral health patient transfers can be very complex. They are, unlike medical transfers, oftentimes there's additional regulations involved. TransferAll was designed in order to take those complexities into place and to help the clinicians identify resources or to coordinate with a crisis team that maybe needs to be looped into the TransferAll platform to help find placement. And so we are creating a nationwide network, and it's not just state-based. If you're on the border of Pennsylvania and you need to send to a neighboring state, you can send the transfer to the neighboring state. So TransferAll is standing up this network that allows the clinician to expedite transfers to all of the participating hospitals in the network simultaneously.
Shannon, one of the things that we keep hearing a lot about as a result of some of the issues around emergency room overcrowding is this idea of bed registries and other kind of solutions that are focused on, increasing the level of transparency with what's happening within individual systems. Can you maybe help us understand what is a bed registry? How does that compare and contrast to the work that TransferAll does as an organization?
Absolutely. Thank you, Joe. And I've worked with bed registries before. And in essence, what a bed registry is intended to do is to provide a clinician looking for a bed with an idea of where the available beds are. So you look at this list of all of the receiving facilities that are options, and you can see who has open beds and who doesn't have open beds. What TransferAll does is flips it around. Instead of saying these are the beds open, it says, these are all of the facilities that are a match, and you can beacon that out. And now it's the receiving facilities that have visibility of the patients that need transfers, right? And so it allows for bidirectional communication through an electronic platform that helps facilitate moving the patients as quickly as possible.
Can you walk us through a little bit around how has TransferAll used data to inform the automation and the approach that you take as you engage your platform with new clients and new participants?
Yes, thank you, Joe. The data is extremely important to the work that TransferAll does, and it's extremely important to the hospitals. We use a continuous quality improvement model at TransferAll, and we use data to drive that, and we use that data with our customers. And one of the results of TransferAll is that we consistently see when we launched TransferAll around an 86% reduction in the time it takes from the initial request to the placement when we move from a manual-based process to the TransferAll behavioral health network.
So Shannon, talk to us a little bit about when you are talking to hospitals about your solution and they have a problem with behavioral health patients in their EDs. What's the implementation process look like generally as you work with them as prospective clients?
Yes, thank you, Joe. We have a customer success team at TransferAll that works on the implementation process with our hospitals. And our implementation process typically takes 4 to 5 weeks with hospitals. In terms of staff time, they're typically on one 45-minute session. And so it is a light lift, and it is a easy to use modern technology tool that is not complicated for healthcare professionals to use.
Shannon, on behalf of myself and of HAPevolve, I wanted to say thank you again for the time, for your expertise, for some of your stories around this really, really important issue to hospitals in Pennsylvania and beyond. Thank you so much for your time today.
Thank you so much for having me. It was a pleasure to be here today.